NCLEX question, Pediatric. 1. The nurse is educating the parents of a 6-month-old about introducing solid foods into the infant's diet, which parental statement indicates a need for further teaching. Answer: I can offer a variety of foods within the first week of introducing. Rationale: the introduction of solid foods generally occurs at age 4 to 6 months. When introducing new foods, parents should allow several 4 to 7 days between each new food to observe for any reactions to a specific food. Allergic responses often worsen with subsequent exposure, so it is a priority to identify food allergies early. 2. Which of the following statements made by the mother of a child recently diagnosed with celiac disease indicates a need for further teaching? Answer: my child can have small amounts of foods containing wheat as long as she remains symptom-free. Rationale: educational objective: all sources of gluten must be eliminated from the diet of a client with celiac disease. Consuming small amounts, even in the absence of clinical symptoms, will increase the risk of damage to the intestinal villi. Clients can have foods containing rice, corn, and potatoes. They should read food labels and follow the diet for the rest of their lives. 3. When performing developmental screenings in the Well Child Clinic, the registered nurse understands that which child is at highest risk of developing autism spectrum disorder. Answer: 4-year-old whose 10-year-old sibling has the disorder. Rationale: educational objective: there is strong scientific evidence of a genetic component to autism spectrum disorder (ASD). As a result, parents who have a child with ASD are at higher risk of having another child with this disorder. There is no evidence that supports a link between vaccines and ASD, and studies on associations between advanced parental age and the disorder are inconclusive. 4. The school nurse is teaching a class of 10-year-old children about prevention of dental caries. Which recommendations would be part of the nurse's teaching plan? Select all that apply. Answers: 1. Chew sugar-free gum. 3. Include milk, yogurt, and cheese in dietary intake. 4. Minimize consumption of sweet, sticky foods. 5. Rinse mouth with water after meals when brushing is not possible. Rationale: dental caries, that is, cavities, form when bacteria, for example Streptococcus mutans, digest carbohydrates in the mouth, producing acids that break down tooth enamel and cause mineral loss. Oral hygiene and dietary intake are significant factors contributing to the development of caries. Clients should increase intake of cariostatic foods, which have an inhibitory effect on the progression of dental caries, for example dairy products, whole grains, fruits and vegetables, sugar-free gum containing xylitol options 1 and 3. Cariogenic foods increase the risk for cavities and should be avoided. These include refined, simple sugars, sweet, sticky foods such as dried fruit, for example, raisins and candy, and sugary beverages, for example, colas and other carbonated beverages, fruit drinks or juices option 4. Additional practices to prevent dental caries include brushing after meals, flossing at least twice a day, rinsing the mouth with water after meals or snacks, drinking tap water rather than bottled water. Most tap water sources add fluoride to promote dental health, whereas most bottled water does not contain fluoride. Finishing meals with a high-protein food. Option 2. Fruit drinks or juices contain high amounts of simple sugars. Substituting these for other sugary beverages does not prevent dental caries. Whole fruits are better choices. To request practice exam topics, just comment down below. Don't forget to share this.